Hello everyone and welcome back to the OncoAlert Weekly Roundup. I'm your host, Gil Morgan. This week's theme is Progress through Precision. From game-changing perioperative strategies in bladder cancer, to biomarker-driven refinements in breast and lung cancer, to novel therapeutic targets across multiple tumor types. The past 7 days have brought us results that sharpen the way that we treat, select, and support our patients. Reminding you that these are just some of our picks, and for a deep review, we encourage you to sign up for our newsletter at www.OncoAlert360.com or through the QR code in the link below. That's www.OncoAlert360.com. We start off with major news from industry. Merck announces that the Phase 3 KEYNOTE-905 trial, also known as EV303, has met its primary and key secondary endpoints in cisplatin-ineligible patients with muscle-invasive bladder cancer. Perioperative treatment with Pembrolizumab plus enfortumab vedotin given before and after surgery significantly improve event-free survival, overall survival, and pathological complete response rates compared with surgery alone. This marks the first systemic therapy approach to extend survival in this high-risk population and could address a critical unmet need in the perioperative bladder cancer setting. And out in the Lancet, the EBCTCG meta-analysis of over 22,000 postmenopausal women in ER-positive early breast cancer found that extending adjuvant aromatase inhibitor therapy for another 5 years after at least 5 years of prior endocrine therapy reduced recurrence and distant recurrence by about 27%, with greater benefit in node-positive patients. However, there was no statistically significant reduction in breast cancer mortality, and fracture risk was increased. Also in breast cancer, a prospective study out on ESMO Open shows that using the Prosigna 50 gene assay on core biopsy samples in early-stage hormone receptor positive HER2 negative disease changed neoadjuvant treatment plans in over a third of cases. Importantly, physicians' confidence improved, and more than 60% of patients reported reduced anxiety, underlining the clinical and psychological value of integrating genomic risk assessment early in the treatment pathway. Out in JITC, results from the ARTISTRY trial, which evaluated Nemvaleukin alfa in previously treated advanced melanoma and RCC. While response rates were modest at 9% in melanoma and 14% in RCC, half of the patients achieved disease control, and the drug demonstrated a favorable safety profile with manageable adverse events. A systemic review out on European Urology looked at SABR for RCC, showing excellent local control in localized disease and promising synergy with immunotherapy in metastatic settings. While high-level evidence for combinations is still lacking, early trials suggest this strategy could delay systemic therapy and improve outcomes. In JCO Precision Oncology, a prospective study compared next-generation sequencing of cell-free tumor DNA from targeted bronchial washing fluid with plasma and tumor tissue in non-small cell lung cancer. The bronchial washing approach detected druggable mutations in 65% of cases, outperforming plasma and tissue, with high concordance and safety. This technique could represent a minimally invasive yet highly sensitive option for genomic profiling. Out in ESMO GI, Japanese real-world data in over 5,000 advanced pancreatic cancer patients showed gemcitabine plus nab-paclitaxel had better time to progression than FOLFIRINOX. Notably, TP53 mutations, especially truncating variants, predicted worse outcomes, specifically in patients receiving GNP, hinting at a regimen-specific prognostic biomarker. In prostate cancer and in clinical cancer research, BMS 986365 emerged as a first-in-class dual androgen receptor degrader and antagonist. Preclinically, it degraded both wild-type and mutant AR, suppressed signaling more effectively than enzalutamide, and inhibited tumor growth in resistant models. Early clinical results showed that PSA declines in heavily pretreated patients, suggesting potential utility regardless of AR mutation status. The joint ESMO-ESTRO framework in the Green Journal provides much-needed guidance on combining radiotherapy with targeted therapies or immunotherapy. It highlights both the potential for improved tumor control and the risk for added toxicity, and offers mechanism-based pragmatic recommendations for safe clinical integration. So what is the big picture this week? Oncology continues to evolve towards precise targeting, smarter integration of modalities, and deeper personalization of care. Whether that's through genomic risk stratification in breast cancer, novel mechanisms in prostate cancer and GI cancers, or optimized perioperative strategies in bladder cancer. These studies remind us that progress isn't just about the next blockbuster drug, it's about aligning the right therapy at the right time for the right patient. That's it for this week's OncoAlert Roundup. I'm Gil Morgan. Thank you for joining me, and I'll see you next week for more oncology updates.